think of that question as a Black person first. Leadership is really secondary, but as a Black person first. The way my background influences the work is that I come from the conditions that I serve. My parents were part of the Great Migration. My dad left Alabama, my mom, North Carolina. They fled segregation. They met in New York. They found a different form of segregation, but a better quality of life, better opportunity. They had my brother and myself. I was born in Brooklyn, but raised in East Harlem in public housing. And the only difference between that community and this area that I serve is the scale, maybe the density, the height, but it's the same conditions. It was a community that had really good people, but it had failing systems. It had systems that were the result of systemic racism that influenced the poor outcomes of education, housing, employment, and wellness. And I didn't know that as a child. I've learned that as an adult because I was surrounded by two parents that loved me, an extended family, and they opened doors, they influenced or emphasized education, and they let me know that was the way out. And they supported that, they demonstrated that, and that was my way to find a better life. I was a good learner, I became employable, I was able to meet an amazing woman and who comes from a very similar background, and we met in college. So we have all of these opportunities primarily as a result of our education, and that gave us choices. And then we went from employers to the employee to the employer. So all of these opportunities, but based upon the ability of our family and support mentors to help us navigate systems. And I feel like that Black experience is not different than the experience of the community that I serve. And I choose this work because I desire to help people navigate these systems, to find their way to a really productive life, a full life, where they can overcome the flaws that the system hands them as far as education, employment, housing, and wellness. In my community, first of all, I have to thank Purpose-Built Communities because the Purpose-Built model is now in 28 cities around the country. It's been doing this work for a long period of time, and it's the same conditions, the same inequities exist in every community. So Purpose-Built has equipped me with some of the tools and skills that allows me to have productive discussions in my community. And that started about a year ago. During all of the unrest of 2020, I was able to identify a group of residents that were brave, that were a wide variety of people that live in our community, live in and around it, that were willing to have a conversation that most Americans don't have. And that's around racism kind of generally. It was about systemic racism in particular. It was a lot of relationship building. It was looking at definitions and identifying what that means locally. So for example, what systemic racism looks like from an educational perspective in my community is that the elementary schools that I serve, there are now 3 of them, and the 3rd grade reading levels, those that can read are between 17 and 40% of kids can read. So it means between 60 and 83% of kids can't read at the 3rd grade level. And most people don't know that. I did not know that till I took on this work. So we talked about that and what that means, how we got here. And then we pivot to how do we move forward as far as solutions? What can we do as a community working with systems to invite more people in to break these cycles? And that's been a really, really productive conversation. It's strengthened the work that we do. It's allowed us to look at the causes and then to change the outcome. And I think we're making really good progress along with that goal of breaking cycles. Yes, there are many roles, many roles. I'll give you one example. I believe that, so the work that I do it is resident or family and systems based. And we're 2 years in, so we spend most of our time at the family level. And one example of what that looks like is we have many, many partners. The community that I serve is about 1,600 families, about 7,800 people. And we have had hundreds of partners. One of them is Palm Beach Atlantic University. We work with hundreds of their students to come in and help serve this community. And one project that speaks to your question is, we work with their nursing and pharmacy students, and their faculty, their staff. We came up with a program where over 4 days, for 12-hour days, we had their students knock on doors in our community to reach out to people. And this was done just a couple of months ago as we're climbing out of the pandemic to check in on people to see how they're doing. My community suffered from isolation before the pandemic has gotten worse, and we're not sure how well people are. So we had these students go in, they conducted a survey, they had a conversation with residents that would open the door. They knocked on over 1,000 doors, they had over 125 interviews. And the interviews were so informative. One of the things we learned is that for most people in that community, people have lived there 30, 40, 50 years, no one had ever come to their home to check on them. Nobody ever asked about their well-being. So what an opportunity. And that tells me that from a healthcare perspective, there's a disconnect. There are clinics, but people aren't connected to the clinics. Despite poverty, there's a high rate of uninsured. So these systems that should support people aren't really working that well because sometimes people don't know, there might be misinformation, or they're not capable of navigating these systems. They need help. And these students help us to make that connection. So that was part one. And our commitment with the students is to do this on an ongoing basis, not a one-time, but a many-time thing so that people can be drawn into these systems that would improve their quality of life. The other thing that we learned was we conducted a survey and we asked, what are the topics that are important to you? And those 125 residents told us that number one by far was managing mental health and stress by far, followed by COVID, nutrition, diabetes, and hypertension. Now we have targets. And we've taken that information and we're working with healthcare providers in the community to come back into our community at our home base to bring those services in, to make them available to the community, starting with those 125 residents, to invite them in to get information about what they're interested in, and then to follow up so that we can improve those outcomes. So that's one way that the community development can bridge that gap. It can make the connection, engage residents with what exists that they're not taking advantage of, and then hopefully ultimately improve the quality and the quantity of their lives. I would say building trust. I come into this area, I've lived here, my wife and I, about 7 years in the community. We're not from here. And for many people, they had to teach me their community. And they were very, very kind. I started with people that have lived here the longest, and they've taught me so much. So the ability to build trust, engage with people, I feel really good about that. They've taught me, and I've been able to serve them and help them. I've been able to help families in particular to navigate, to help improve their employment, education, housing, and or wellness. And then I've been able to bring people together. There are people in the community that when I met them, they have been advocates and they were exhausted. And some were considering leaving and others have given up. What I've been able to do is pull in other resources to reach across the railroad tracks, if you will, and bring people together so they get a second win, and then bring in outsiders that help elevate their work. And all of that's allowed us to get some things done in a short period of time that the community appreciates. And that includes listening to the community and asking them questions so that while we worked at a family level on an individual basis, through a series of workshops and engagement, we now have a very clear strategic community improvement plan that was built by the people that we serve. And now we know very clearly what the community wants as far as education, employment, housing, and wellness, and we're at work to get those things done. And the people in the community are happy for that we've listened to them, we've heard their concerns, and we're working to achieve those goals.